Hi, Heidi Gaiman here, licensed clinical social worker and mental health care provider. Today, I want to talk a little bit about trauma and the difference between being trauma informed and treating trauma. I just covered this with a friend for a paper she was doing, and I was like, this is very useful information, actually, maybe for other people. The thing about it is, we know enough about trauma, and it's actually like wide enough disseminated in our cultures that honestly most places we enter should be trauma informed. Like, we're at that place. There's actually pretty short trainings you can take online. You can Google articles that'll give you the 6, 7 to 9 elements that bring trauma informed awareness to a space, a place, or if you're trying to build a culture even within your own home. So I encourage you to do that. However, treatment of trauma is actually directed toward a very specific client's needs and specific traumas. If you are trying to be trauma informed, you do not need to know about every specific trauma out there. You do not need to know how to heal it and the nature of implicit memories and all of that. You can. That's awesome. Like, please be nerdy with me. And being trauma informed means looking at the person in front of you and understanding that we all have baggage. And that when we bring that baggage, sometimes that baggage brings energy with it, and sometimes it brings a release of the availability of that energy. And so it looks very different in different people. But yeah, it can impact all of us in many, many different ways, not only individually, but also in our interactions. So please do a little bit of work, a little Googling to be trauma informed if you can. Take the trainings, do the thing, and know that it's not your job to individually heal everyone's trauma. Look for more coming up on trauma and the nature of trauma and how it impacts us in the coming life and relationships and mental health videos to come. Always find me at HeidiGaiman.com.